All right, well, good afternoon, everyone, and welcome to the first age-friendly public health system training for 2022. I'm Megan Wolfe, Senior Policy Development Manager at Trust for America's Health, or TFAH, and I lead the age-friendly public health system, or as we call it, AFPHS initiative. We're delighted to have you all here today to join us for what is really our second installment of training on how to communicate about aging. So first, a little housekeeping. So Karan, next slide, please. So please make sure to keep your devices on mute during the presentation. If you have questions during the presentation, you can submit them in the chat, and we can, try and answer them as we go. Trish, if you'd like to do that, or we can hold them all to the end, kind of whatever works best.
Might be best to hold till the end unless it's a really pressing question.
All right, so we will hold them to the end, and then we will capture those questions and share them and have a discussion at the end. So I hope you all enjoy the presentation today and learn a lot. I always learn so much from Trish and her colleagues. So I am going to turn the mic over to my colleague, Dr. Karan Phillips, who will introduce our speaker. Karan.
All right, good afternoon, everyone. Give me 1 second as I orient my screen. Okay, so today's presenter is Patricia D'Antonio, and she is the Vice President of Professional Affairs for the Gerontological Society of America and a board-certified geriatric pharmacist. Trish is responsible for developing and managing GSA's relationships with other organizations in the area of aging, aging arena, and leading major society programs and projects. She directs GSA's policy initiatives through the National Academy on an Aging Society, GSA's nonpartisan Public Policy Institute. And in addition, she serves as a project director for the Reframing Aging Initiative. And she is also trained as the Reframing Aging Facilitator. She received her bachelor's in pharmacy from I'm going to mispronounce this, Trish, you're going to have to correct me.
Duquesne,
thank you. University in Pittsburgh. And she received a Master's of Science in Health Finance and Master of Business Administration with a concentration in healthcare from Temple University in Philadelphia. And she completed her residency in administration and finance at the Philadelphia Geriatric Center. So without further delay, it is my absolute pleasure to almost introduce, I would say, a friend at this point. We had her again last year. We're kicking off our second installment of our ageism training. Patricia D'Antonio, so I will have you take it away.
Thank you so much, Karan and Megan, and Happy New Year, everyone. Let's just advance the slides because we are going to be talking today about the initiatives to frame your communication strategies around aging. So I want to be sure that you're all familiar with reframing aging. People might hear it in different sectors, but let's level set there. Understand why framing your communications is so important if we're looking to gain support for policies and practices for all of us as we age. Talk a little bit about cultural models and the evidence that we gathered that brought us to this project, and then define a few ways that you can frame your communications. So if we look at the next slide, I want to just tell you a little bit about the organization that I work for, the Gerontological Society of America. If you're not familiar, we are a professional membership organization. We are multidisciplinary, so our members come from a variety of different backgrounds, but what's common is the research and education in aging. So we have members who study biology, who are in health sciences, who are social scientists, but all of us, we organize around aging. You can look at the next slide. So as we're starting here, I just want to get everybody to think about everyday ageism. And if you wouldn't mind, chat in maybe some experiences you've had with ageism. Does any of this ring true? Have you seen anything else that might look relatively innocuous, except that it really does get us to think negatively about aging? And these jokes start at an early age, right? It's the jokes we hear our parents tell. It's what we see on television, characters that we see on television. Think of some of the advertisements that you see. Think of some of the magazines where people tell us about aging. What is that? That really gets us to think about aging in somewhat of a negative way. It seems minor, but what it really does is this impacts how we think about others, and this impacts how we think about ourselves. Think about this tsunami metaphor. What would you do if somebody told you there was a tsunami coming? Right? You'd run away. So think about the impact of these. And I think there's no better place than if we go to the next slide about where we can see those topics just out there for the public. So what's better than a birthday? Almost anything. Be careful about swimming. Lifeguards don't try as hard. Happy birthday. I mean, really, like somebody's saying you might drown, but happy birthday. Don't be upset about turning 60. Lots of people are 60. Why, if you take all the 60-year-olds in the world and lay them end to end, very few of them will be able to get back up under their own power. Happy 60th birthday. How's that feel when you hear it? These ladies we all see, right? Where are you headed? I don't know. I thought you were driving, right? Happy birthday. And then, the 5 decades of wishes. And if we go to the next slide, if we advance it, you're 50, hope you get just what you want. At 50, you forgot what you want. And we make fun of that, right? That starts to impact how we think about aging, right? It's just reinforced constantly for us. And if you go to the next slide, we have research that shows us that people do experience everyday ageism. In fact, in this study of a survey of adults age 50 through 80, 82% of people reported experiencing one or more forms of ageism in their day-to-day lives. And that's exposure to ageism externally, but it's also internalized ageism. And that's really important to think about too. We internalize it ourselves. In our work, if we go to the next slide, we talk a lot about words matter. And recently, there's a new museum in Washington, D.C. called Planet Word. And their mask that they're handing out, everybody has our masks now for COVID. They're handing out a mask that talks about words matter. And I want to show you a little bit in the next slide why that matters. So our researchers, and I'll get into more detail about them, but the Frameworks Institute, they gave participants 5 terms to describe older people and asked them to rate them on a 5-point scale across a number of competence-related adjectives, such as technology capable, frail, independent, wise. And here you can see with an average, we have an overall measure, that top line there, of perceived competence based on the word that you use. In a second experiment, researchers gave the participants one of the labels shown in the bottom graphic and asked them to indicate how old do you think this person is? So a senior, an older adult, an older person, a senior citizen. Responses from the participants were averaged and the mean ages are indicated below, right? So a senior is 69 years old. An older adult is 54 years old. So while older adult is the term that we tend to use, we really find that using the term older person gets us to the age group that we're really trying to describe when we talk about age and we talk about age-related policies and practices. In fact, if you ask 18-year-olds sometimes in studies, there's some research out there that says if you ask an 18-year-old how old is an older adult, usually the answer is somewhere between 40 and 45. So it really is how we frame our messages. And we could go to the next slide, and I'll talk a little bit about this again as we get into the presentation a little bit more deeply. But experts in aging were interviewed, and you can see here on one side, experts embrace aging. The environment determines our outcomes as we age, whereas the public looks at it as an individual issue. We believe as aging experts that there is plenty that we can do to ensure well-being in older age. The public, nothing much. And not only that, but there's not even much thought about ageism and its impact when interviewing the public. So what kind of drives this is what we call in the next slide, you say, they think, right? And in this perspective, when you think about it, is we think we wrote the best message to communicate about a topic in aging, right? When we use the term elderly, what people think of right away, because of what's deeply rooted in our minds about how to process all the information we get, is, oh, that's somebody who's frail and dependent. No matter what we're talking about, we could be talking about the elderly going on a cruise. Well, they're all frail people who are going on this cruise. If we go to the next slide, here's another example. When we use the term aging population, right? Aging population feels so big. How do we embrace that? So where we would normally describe that in anything that we write, in anything that we speak and understand, as experts, what that means, that sheer size of an aging population sort of cues us back to what we're thinking about with the tsunami. That's a big problem. We can't get our heads around it. Let's go someplace else and figure out what we can do in another area. It shuts down people's motivation to think about how to address aging. So I want to talk a little bit about how we define ageism. On the next slide, we talk about this discrimination against persons of a certain age group. So our project tends to lean toward older people, right? Our research was around aging and older people, but let's remember that ageism is across the life course. And one of the biggest questions I get is, well, what do you think about millennials and the okay boomer? And I say, well, what do you think back when older people say something like, oh, you millennials and your avocado toast, right? So there's something there that we have to recognize, that we have to think about that discrimination across the life course, right? There's the implicit bias, right? Our subconscious bias. That's been working on us since we were 3-4 years old. There's also that external and internal ageism, right? We perpetuated ourselves, or others perpetuated in what we saw in the ads. And I appreciate, the Geico ads, they drive me nuts. The Geico ads drive me nuts. And then the negative connotations about aging. I think that's really important. And I appreciate you posting that we all hear that and we experience it. And so it's really important for us to call it out. So we go to the next slide. What I wanted to share with you is, some of the things that we really have to pay attention to, because there's cost to this, there's impact to it. If you're not familiar, there's some work from Dr. Becca Levy at Yale University. She and her colleagues have done some work where we see that it costs our healthcare system $63 billion a year when we see when ageism influences our healthcare system. So it's 1 in every $7 spent. Think about what we could do, right? Think about what we could do with that money. Let's look at the next slide, and I could talk a little bit more about this research. So in 2020, she and her team published a systematic review looking at the global reach of ageism on an older person's health. And she identified 2 levels of ageism, right? That individual or internalized ageism, what I think about myself and whether I'm going to, I have that pain, I'm not going to go to the doctor, I have it because I'm 65 years old, right? Those stereotypes, those negative self-perceptions that we may have about ourselves as we age. The joke we tell, like, oh, I just can't get out of the car as quickly as I used to. I'm getting old, right? And then the structural ageism, right? So the policies and practices or procedures that occur, right? Like the actions of staff in a hospital, or how we address the worldwide pandemic. So let's go to the next slide. Her team found that people who hold negative self-perceptions of aging are less likely to seek medical treatment, more likely to experience a cardiovascular event, more likely to persist with health risks. Can't teach a dog old new tricks, right? I've been smoking forever. More likely to experience functional decline and depression. Think about this. This is something that we all deal with in our everyday work around how we perceive healthy aging, right? And if we look at at the next slide, when we talk about structural aging, there's a study by Rogers and colleagues about discrimination in healthcare settings. And when researchers looked at data for more than 6,000 Americans older than 50, they found that 1 in 5 adults experienced ageism in a healthcare setting. And for people with functional challenges, experiencing ageism was found to make things worse, right? Less able to do things like bathing, feeding, and dressing, right? Our activities of daily living. Other studies have found that healthcare workers' attitudes affect the health outcomes of older people. And one study of medical residents found that their thoughts about older adults are primarily related to death, disease, and decline in functioning. So if that's what you're thinking about when you approach an older person to treat them, what's that impact there, right? These ageist attitudes can create unnecessary pain, indignity, and distress, and reinforce our internalized ageism. It causes recipients to fail to follow a doctor's care plan. Right? We ignore medical advice. Women, who make up the majority of people over the age of 65, experience more intense discrimination. And we think about that intersection, right? We do not compare one to the other, but we think about that intersection of sexism and ageism. These attitudes also result in denial of care or aging, rationing resources as we age. And we heard that during the pandemic. Simply because of your chronological age, we were going to forego treatment for someone, right? So the number of birthdays you celebrated, as opposed to recognizing our diversity as we age and how functional age is much more important to consider. We could go to the next slide because I don't want to depress you here. I want you to know that there's some good news. Positive perceptions of aging lead to people living 7.5 years longer, right? And a healthier lifespan. And this piece, I'm sure if you've heard me speak before, because it's most fascinating to me, people with a positive age belief, if they're carrying the markers for dementia, they are 50% less likely to develop the dementia when they have a positive age belief as compared to their colleagues, their cohort who have negative perceptions of aging. And we have more research that supports that reframing aging and framing messages can work. And if we could advance the slides, one thing that we know is that the interventions that we've worked with and developed with Frameworks Institute, we were able to show that when you make people aware of their implicit bias, you're able to get them to start to understand and change that bias around aging. We also know that there are interventions that have been studied that can reduce ageism. And if we go to the next slide, I can go into that a little bit more. Carl Pilmer and his colleagues published this article in the American Journal of Public Health. And the World Health Organization recruited a team of researchers to look at interventions to reduce ageism. And through a systematic review and a meta-analysis. If you have a chance to take a look at this article, I highly recommend it. Many of the education interventions targeted college students and graduate students in health-related fields. A medical school curriculum, for example, included information on the positive aspects of aging and how students can become aware of their own negative stereotypes that might affect the way they treat an older person. And then in efforts to foster contact between generations, high school students interviewed older adults about their life history, and then those older adults tutored elementary school students or played games with them and did crafts with them, and that starts to peel away at that implicit bias that people have. So a lot of the successful interventions combine both education and intergenerational contact. If we go to the next slide, we could see that these interventions actually do work to improve attitudes that people have towards older adults and increase their comfort level with older people. Right. And given what's at stake, if we don't reduce that understanding of aging, right, if we don't reduce that ageism, if we don't improve that understanding of aging, these interventions are really not very expensive. They're rather low cost, and they're worth investing in when you think back to the $63 billion cost to the healthcare system when we have our biases about aging. So we also, from the University of Michigan study, if we go to the next slide that I showed you earlier about people, over 80% of people experiencing some sort of form of ageism, is that when we asked, when the researchers asked about positive views on aging, you see here that people actually found out that their life is better than they thought it would be. They do feel more positive about aging as they're aging, and they have a strong sense of purpose. I mean, think about how that is. People think about aging as a journey, not a destination, right? So that leads us to the next slide and what the Reframing Aging Initiative is, right? So it's a long-term cultural change initiative, and it's designed to improve the public's understanding of aging and understand the many contributions older people can bring for society. If we go to the next slide, and I'm going to go through these very quickly, this initiative is led by GSA on behalf of the leaders of aging organizations. You may recognize some of these organizations that you work with in your community or that you're involved with and participate with. And the executive directors got together about 10 years ago now and said, what's the one issue that keeps holding us back? And it was around policy initiatives in aging and ageism that came through there. So that's how they came to think about what we could do. And that's where the Reframing Aging Initiative was born. If we go to the next slide, we do have philanthropic funders, national funders that support us, the John A. Hartford Foundation, RRF Foundation for Aging, SCAN Foundation, and the Archstone Foundation. And then if we go to the next slide, I'll talk a little bit more about this later, but we do have additional support from local and regional funders based on some work that we do to help advance the initiative in communities. So we could go to the next slide. And we worked with a research partner, the Frameworks Institute. If you're not familiar with them, I think the most important thing to take away from this is they're a nonprofit think tank. Their mission is to advance the nonprofit sector's capacity to frame social issues. So they have worked on a myriad of issues, and you may be familiar with some around housing, around early childhood development, around food and food understanding how we should be describing that. They're working currently on a nursing home initiative as well. So helping us all understand how we can communicate better. So what does it take to frame an issue? Let's go to the next slide. We tried to, we worked with frameworks. They mapped the terrain, right? We went out and did the research that we needed to do, interviewed people. What's their understanding of aging? Interviewed experts, interviewed the public. And then develop that strategy, right? Figure out what are those key points, key messages, key strategies that should be applied that get people to move the needle a little bit on how people understand aging. And this is where we are here. We're building the caravan. We're disseminating the information. We're trying to equip you all as travelers to start moving forward on how you talk about aging. Let's go to the next slide. One thing I hope that you see is that if you situate yourself in the field where you are, think about how your work helps turn the gears so that we can frame people's understanding about aging differently. So let's go to the next slide. Now, one thing that we know from our research is if we can get people starting to communicate about this, right? So our program providers, our funders, our researchers, our advocates, our educators, it starts to change the discourse. You'll start to hear people talk about aging differently, which changes how we think about aging. We know that this impacts policy and practice, and that's our ultimate goal with this collective contribution to change. And if we go to the next slide, I'm going to use this slide just so that I can take a quick glass of water. And I just want to offer some framing fundamentals for you, what to think about. And we'll go to the next slide. Thanks, Karan. What does it mean when we're saying we're framing? And it's really about how we present information, right? We all frame. We frame when we're talking professionally. We frame when we're talking with our friends and families, right? And it's whether we know we're being conscious about it or not is really what makes the difference, right? So our choices could be verbal, right? Are we talking really strongly, right? Are we talking softly? I can't help it. I talk a lot with my hands. So you can tell when I'm more excited about something and maybe when I'm not as excited about something. It's really important about what we're choosing to emphasize in our messages and what we're explaining. And then even more importantly, what we leave unsaid, right? So framing can actually be a very powerful tool, and not just here, but hopefully I can share with you ways that you can frame your communications about aging a little bit differently. So we know on the next slide that when a frame works, it shifts thinking in multiple ways. So in our research, right, we know that we were able to expose study participants to different messages about aging. With most of these frames, people's support for the kinds of statements went up compared to the control group, right? So when we provided well-framed messages about aging, we were able to see people's knowledge, attitudes, and then ultimately support for a statement change because they were exposed to a different way of thinking and talking about aging. So let's go to the next slide. We learned a lot from our research, right? We learned the public has conflicting and ultimately incomplete beliefs about older people, right? People are either living a life of leisure, right? We're all going on a cruise, or we're all jumping out of planes at 80 years old, or everybody's frail, bedridden, needs a walker to get around, right? So it's very incomplete. It's a dichotomy there. The other thing is that ageism is not considered a problem. Now, we know from our colleagues at AARP, right, that there's 3 in 5 people over the age of 50 experience some form of ageism in work. What the public says is, well, it's not an issue because we have workplace discrimination laws in place. So, that's not an issue. What we do work with in framing are the cultural models or the cognitive shortcuts that we all rely on to process information. So we go to the next slide. I want to go back to this mapping the gaps and really think about this. When aging experts talk about, when we talk about aging, we are so embracing of aging, right? But think about what you hear in the public. We battle aging, right? Oh my gosh, you got to get rid of those little lines and wrinkles, ladies, right? Color your hair. People will, in interviews that we actually have tape of, people they have physical ways that when they talk about aging, they actually push back. Their language changes, people are going to die. I mean, I could show you these videos sometime, and you really do hear it, and you hear it differently. The other thing that I think that's really important is that we recognize that outcomes can be influenced by environment, not just individual actions that we take. And I have an example when we go forward and talk about this. So we go to the next slide. I just want you to take a minute and say, we'll go to the next slide. Think about a swamp. Now, in a swamp, you have mosquitoes and you have alligators, but you also have orchids, you have beautifully colored birds and butterflies. And those really make a difference for us when we think about what's in that. And we use that as a metaphor for the cultural models, right? The cognitive shortcuts that we take. It's a rich, complex ecosystem, right? All that's coming into our brain. It's a rich, complex ecosystem. So let's go to the next slide. I don't think go to the next one after that. The first thing I want to talk to you about are the challenges that we see in the swamp, right? So, these are the mosquitoes, these are the crocodiles, this is that humidity that you might not like. think about these as the challenges or the patterns of thinking that'll get in the way of how we perceive, how we understand aging, and how it impacts ageism, right? So knowing these patterns, we can make some changes in our communications that will avoid these traps. And I sort of referenced a couple of, throughout our talk here today, right? Fatalism, right? That tsunami that's going to come over and you got to run away from that. We talk about demographic cliffs, right? How many times have you heard the demographic cliff? Well, you're going to jump. Individualism, lifestyle choices. Think about this. If only you had saved your whole life, then you would have money for retirement. Now, what does that statement exclude? It does not think about all the other things around your life that might have impacted whether you could save or not, right? Are you working a minimum wage job? Are you working 3 minimum wage jobs to be able to make ends meet, to pay rent, and to send your children to school? Right? That doesn't, if only if you had eaten better your whole life, you wouldn't be sick now. Well, that doesn't take into account that I may live in a food desert, or I may not have access to healthy fruits and vegetables all the time, right? The other one that I would call out is that us versus them. Whenever we hear people talk about, and I'd say this is the easiest thing that you can do. If you wanted to start to frame your messages different, after you write something or after you prepare something, look at how you describe older people. And hopefully what you're hearing as I talk about all of us as we age, as we are turning 65, right? So if you look at those pronouns and see, are you othering older people in what you're writing, and you change the them to an us, you will really start to see how you're making a difference and how you can get people to understand we're all aging, right? That ideal versus perceived real, we talked about that earned life of leisure, right? We're all going on cruises. I love that. Whenever you see the cruise commercials, and thinking about that, or none of us, we need, somebody has to tell us what to do, right? That loss of control, because you're not smart enough to think about what you want to do next in your life because you're a chronological age, right? Let's go to the next slide, because there are opportunities, and we know that it's harder to cue these in our brains. But if we bring these patterns of thinking forward, we really make a difference, right? So what surrounds us shapes us. What we think, when I was talking about where we are, where we live, what do we need in our communities to ensure that we all can live healthier lives? And notice, I'm not saying that this has to happen for somebody specifically when they're 65, right? This has to happen in our community for all of us to benefit us all as we age. We have a collective responsibility to care for our communities. Right. And we all think that when we start to cue certain values, and I'll talk about telling the story. And then, of course, there's this value of ingenuity in American culture that problems can be addressed and solved. Right. We put a man on the moon first. We want to be able to tell a story, right? We always want to be able to tell a story to describe what we're doing. And in the next slide, what I want to be able to show you is that it's not just any story that you want to tell. You want to tell an effective social issue narrative. And what our research shows, that'll help build the understanding and shift opinion, shift perspective about aging, and generate the support for solutions. So when we tell that story, we want to make sure we're cueing values that are tested, that we know move the needle on how people think about aging. So why does this matter? Right? We want to make sure that we're given examples and metaphors that people can connect with, right? How does this work? And if it's not working, why not? Right? And then what can we do about it? And we want to provide solutions, right? We don't want to just walk up with a problem and walk away. But it's not any singular solution. It's a systemic solution that we want to be able to think about, right? That's what's going to be able to move the needle on issues that we want to do. And we know through our research, if we go to the next slide, what our goal is when we're telling this story, we're going to cue up those values so that we can activate the productive models that we have in our head, that, we're processing information at how many milliseconds probably nanoseconds, right? As we're even sitting here, right? When I say certain things, it's cueing something in your brain so that you can interpret it quickly. We want to cue those productive models that help tell the more complete story about aging, right? So we're not Pollyanna and everything. This initiative is not about all about the aging and the cruise, right? It's about understanding that we have meaningful lives as we age because we have systems and we have policies in place that support us all as we age, right? So if we need a wheelchair, we have access to that wheelchair. If we want to run a race at 82 years old, we can run that race at 82 years old. So in telling this new story about aging, let's look at the next slide. I just want to let you know, I talk about our research base. The research base included more than 12,000 members of the public. It's a representative sample of people who have lived in American culture for at least 3 years, right? So one of the things that when I talk to you about the words matter at the beginning, one thing to think about in some cultures, we know some of those words are the right words to use. So elder, right, is a very revered term in some communities. So if it is, use it. We also know that if we start to refer to the elderly all the time, that starts to cue that negative assumption about aging. So think about that. And in our tested narratives, those that cue that more complete perception of aging are those where we talk about the values of justice and ingenuity. And so that's where we came with these narratives of confronting injustice and embracing the dynamic. We want to build momentum, people to understand how we're doing that. It explains our implicit bias. Now, we don't have time in 1 hour to go really deep into these narratives, what that means, how you work it, and we have resources to be able to help you think about that. But I did want to give a couple examples to show you what that means. If we go to the next slide, there's some things that you should avoid when you're talking and some things that you can advance in your communications. And notice, I didn't come here today with like a campaign of use this slogan and all will be solved. That's not what this is. This really is a communication strategy. What can you apply in your communications wherever you see yourself, right? So we want to be sure that when you're talking, what do you want to emphasize here? Remember that slide we talked about what to emphasize, what to explain, and what to leave unsaid, right? So we're avoiding those concepts of aging being a process of decline, right? Older people as other. Remember, we pushing somebody away. And that aging is a crisis, right? That fatalistic talk. What we want to advance is that the future is a time for improvement, right? That we're all better off by being inclusive. And that our stories are solution stories, the supports and the systems that are important. And then finally, talk to people about how ageism works. When you call it out, it makes a difference. So I want to show you some examples of where we've made a difference. So our colleagues in Colorado, changing the narrative on the next slide. How would you like, wouldn't you rather get, if you advance it one more time, a birthday card that says, celebrate your seasons, happy birthday to majestic, wise, and venerable you? Right? So think about that. What makes the difference there and how you think about a birthday card. This one I really like. Our colleagues in Boston, if we go to the next slide. Which shuttle would you rather ride? The senior shuttle or the Age Strong shuttle redesign that says we are transporting Boston's most experienced people? So when I talk about reframing aging, it's not just that I don't use the word senior anymore, but here's what somebody's going to see every day as the shuttle goes through the streets of Boston. And another example that I'd like to show you is the Administration for Community Living's Older Americans Month description last year, right? This was really good. It talked about, when people say, well, how do I write this into my sentence? And note that there is no perfect answer for these, for when you start to change things, right? You just take a couple steps at a time, right? So none of us writes the perfect, well-framed message, but we keep building on that, right? And in here, here we talk about, older adults are a key source of strength, right? Experiences, successes, difficulties, we recognize resilience, right? So all of this builds some momentum to understand aging, right? And when communities tap into this, they become stronger too, right? So when we tap into the resource of older people, we become stronger too. So just think about that. When people start to hear that and see that, what kind of difference it makes. One thing I would like to show you is some of the work that we did around COVID-19. And in the next slide, I'll show you like a before and after. We saw and we heard many statements where we were talking about vulnerable seniors, right? So it's the seniors' fault. They're vulnerable with respect to COVID. So vulnerable seniors at the center of the COVID crisis. Now, we're talking about fatalism and crisis. A pandemic is a crisis. So you have to balance that urgency and efficacy. But listen to this instead. Older people are disproportionately impacted by COVID, right? Older people impacted are vulnerable to COVID. They're not vulnerable older people, right? And you could say this with any disease, right? Vulnerable older people, cardiovascular disease, right? Impacted, but they're vulnerable to the disease. So states are planning community actions to reduce everyone's exposure to the virus. A little bit of a difference there, right? If we go to the next slide. Those were just examples. But one thing I also wanted to make you aware of is a partnership that we have with the National Center on Elder Abuse. And I know that this is important in your communities as well. If you haven't checked out their resources, based on the work that we did in Reframing Aging, the Administration for Community Living invested in how we can reframe, how we can talk about elder abuse. And there's definitely some really great work on their websites to think about how you have that conversation. So I would highly recommend that you take a look at that. It talks about the structure of justice and, how you tell that narrative. Again, just like the way I talked about a little bit earlier, how you tell that narrative. In the next slide, I also mentioned a little bit about how we're working in different communities. We are either working with aging organizations or we are working with community funders to advance reframing aging, advance the principles in specific communities. And we can work and we can talk about this as how state and local organizations become members. And this way, we know that we can't do this all nationally from a national center, right? And we know that we have to have this common communication that is flowing. So when it's working locally and bubbling up, and when it's working nationally and spreading out, we really can start to address ageism. So we've done a lot of work in the Chicago area, in Iowa. We've done work in Mississippi. We have a great project working in San Antonio, which is Successfully Aging and Living in San Antonio, or SALSA. So I really like talking about that. And you can see how we're starting to really build on this. That will make a difference and start to change how the narrative changes. And you'll start to hear people talking and you'll say, oh, hey, I heard that when I participated in a framing session, right? When you start to hear somebody say, all of us as we age, that came from this session, right? So think about that, how that makes a difference when we talk about that. And we'd be happy to talk to anybody about how to move forward with that if you're interested for your locale, for your jurisdiction. Individually, what can you do? So let's go to the next slide. So there's a quick start guide on our website that I would definitely say take a look at, right? It's going to take you right through and say, avoid these phrases, think about using other phrases. We have a newsletter that comes out every other month. It's electronic. It's called Caravan. We spotlight and highlight work that people are doing around the country, not just the national work that we're doing, but the work that we're seeing in those communities and how people are starting to frame to key leaders who can really make some change, or how they're framing their own work so that people will model that language, right? We're trying to get people to model the language. There's an implicit association test on Harvard's website that you can take around aging. I will admit that I was a little bit over on the ageism side, a little bit more than I thought I would be. So you'd be surprised when you go through that. You might think, no, that won't be me. And yeah. And then I would just encourage you to call out ageism when you hear it. Don't always have to be like pointing a finger in somebody's, face and saying, that's ageist. You could ask somebody, what do they mean by that? And how do they understand it? And I have had experience with that in my family, with my nieces and nephews. And when I brought it up and I explained it and asked a little bit more about how they perceived it, right away, big change, right away. So you can start to see that when you call it out in a way. Lastly, before we go to Q&A, what I would like to do is ask you to all take out whatever device you have that you keep your calendar on. So I keep 2 calendars, an electronic one, and then I have a paper one just to I can have in my purse when I need it. But take that out, and I want you to go to February 20th, and I want you to make an appointment at 9 a.m. in whatever time zone you are. And all I want you to do is write, what did I do in the last 30 days to reframe aging? So just set that up as a tickler for you, as a reminder for you, because this is how we create a movement, right? We have to start. Is it that you're going to avoid those fatalistic statements? Did you start to look at something on your website that talks about they when you talk about older people? So just one simple thing. So with that, I want to go to the next slide and say thank you for your attention. I want you to recognize that this is a long-term initiative. We are trying to change American culture. This is challenging. It's really challenging around the universal experience of aging. But the ongoing impact and the more complete positive perceptions of aging will be priceless. We have colleagues in Ohio who have buttons that say, aging is so cool, everybody's doing it. So with that, I will say thank you, and I'm happy to take questions or if anybody has any comments. So Megan and Karan, however you want to manage that.
Great.
I'm sorry, I
Thank you
didn't
so
get a
much,
chance
Trish.
to chat.
No, thank you so much. I love that button, and I want one. I think I said that last time. I want one of those buttons. They're so cool. Could we take the slides down at this point, Karan, so we can kind of see folks? So yeah, if anybody has a question, if you'd like to come off of mute, put yourself, show your video if you're willing to do so. Trish is here. She's willing to answer questions, and this is a tough area. I think. I mean, I've caught myself in writing many times over the last few months, even, and I've had this training before, but I'm still catching myself. So, anybody have questions?
I catch myself driving. When I'm driving, that's when I really have to remind myself.
Interesting. I have a question, or maybe this can stimulate some conversation. We talk about the aging population, and in the beginning of your presentation, that was one of the negative ways of talking about those of us who are getting older. But we do want to raise the awareness of policymakers of the need to address challenges for those of us who are getting older. And so how can we do that? What's the language that we can use? How do we motivate policymakers without making, without talking about a tsunami, without, how can we create a sense of urgency without creating a sense of doom?
So one example that I can give you that I find my role at GSA, I lead our policy initiatives. So I represent GSA in several coalitions and coalition letters that we're writing. And we're all attuned to starting with, in 2030, how many people will become over the age of 65? Now, I say this and I say it kind of droll because It really does. It is the piece that people go, yeah, I know this already. And it turns, or it gets people to say, well, we're going to have so many people over the age of 65. You hear people like, well, we're going to bankrupt the system. Whatever the system is, we're bankrupting the system because everybody's aging.
Right.
Now, it's important to describe that, but sometimes you can move that to the third paragraph of what you have to describe. And you, in your first paragraph, address the issue in a sense of, in society, we value all of we value all our citizens, right? Some way that you're describing that, and then you can kind of go into whatever that issue is that you're trying to raise, whether it's food policy or transportation policy or whatever. But you don't have to lead with the statistics about aging. You can bring that into the third paragraph in some way. And it starts to change the tone of the entire piece that you've written, right? Whether that's a letter or a policy brief. We had some pieces that we looked at that somebody provided, and really it othered older people. And so it was kind of like, well, I don't have to pay attention to this. It's not me. I don't see myself in this, right? So you want to be able to think about how you position something sometimes. It's not that you don't want to give people the data. We want people to have the data that's going to help them move with the needle. But that crisis message is not, and when I'm with my colleagues, sometimes they're like, but this is how we always do it. I'm like, yeah, and how are we doing? Just try something different for once. It's okay. If it doesn't work, then you can laugh at me and try it. Go back to what you think you're doing that's going to work. Yeah. But I think we have some research behind us that shows us that. And we have to do it consistently, right? We have to get people to start, when you get people to start modeling your language, then you're doing it well. Because I'm not walking up to you and saying, Megan, I want you to frame aging. I'm just going to talk in a way. And then when you go on to talk to somebody else, you're going to say, well, I heard this person speak, and you're just going to pick up what they say. Same thing with the press, right? We can't just go to the press and tell them you need to write this way, because it's kind of like a journalist does not, that's part of their ethics, that they cover the story that they have to cover. But they will model what's said when we talk about the research or when we talk about whatever that story is, and we tell that they'll model the language we use. And that's what's important. Yeah. Right? So if we talk about a policy that benefits us all as we age, they'll write that. You'll see it in the writing.
Right. We're starting to talk more about the life course, and particularly in health, how important it is to address prevention across the life course, so that helps us to incorporate and be inclusive of the older adult population. I see Marcy has her hand raised. Marcy, you want to come off mute?
Sure. Sorry. Yeah, thank you again, Trish. I put some comment in the chat, but thanks so much for today. And I just wondering, can you give some suggestions how you may have handled when you've heard ageism in the workplace? Like, example, someone might say, well, that epidemiologist is older and so might not be as well informed as a younger person, or etc. Do you have some ways that you can do that? Because I do try to address things like that when I hear it, but I'm not sure I'm always so effective. So I'd love some suggestions.
So a couple things. First, be consistent, right? Because remember, I keep saying this is long-term. I kid you not about long-term. It's a generational change. We know from the research it's going to take us about 20 years to get people to understand this. The second piece is, we know that there's research that shows that older people are not as digitally incompetent as everybody wants to make them out to be. So out at Stanford, there's been some research done about that. And so, we have to appeal to try to understand why someone thinks that way first, right? So tell me a little bit more about your understanding of this, right? Why are we making this assumption about all epidemiologists that are over a certain age, right? So try to get an understanding, right? It was kind of that, you got to watch the finger wagging just as much as we wouldn't want somebody wagging a finger at us, right? And also, I think you kind of have to recognize that while someone might not have that competence, they have the experience to understand so much more about that project that you're working on. So, there might be somebody across the age. There might be somebody who has a who's not competent with certain programs or certain resources that you want to use, and you have to tap into the experiences and the resources that person can bring to the table. And I think we have to point that out, right? No, I can't work an Excel spreadsheet fast as you can, or work any kind of a database as fast as you can. But I know where to start to look for where the problems might be in that data because of my experience. So thinking about that is just as important, what we all bring to the table. We also have to point out that the assumption that none of us knows how to work an iPhone as we age really isn't as true as people might want to think it is. How's that?
Excellent.
Yeah, that was really helpful. So thank you.
Okay.
I think the other thing, as you're talking, I realize is that sometimes when you're in an interview panel and you may know them because they work in your organization. I just threw that out as an example, but that sometimes I find when I've gotten older that I'm more confident and might be more outspoken. And so I also think sometimes people might want to hire someone who's more malleable, and so I think that's the other thing to bring out is maybe when people do say that, if they know the person, oh, well, what is it that bothers you? So that, that you can help people get at their underlying bias. But what you said was really helpful. It has been a long time since I've heard that, but I just want to be prepared for if I hear it again, because I like to adjust.
Well, good luck.
Thanks.
Thank you, Marcy. I also wanted to share that the Age Friendly Institute has created, I forget now what it's called. The acronym is CAFE, but it's Age Friendly Employers. So you can go on the Age Friendly Institute website, and they have identified employers that are age friendly. So they are working hard to eliminate any bias with regard to any age, which I think is very cool. Leslie, you have your hand raised.
Yes, I just had this conversation just before the new year with one of my clients who's turning 75, and she has a lot of
Leslie, I think
Sorry. Okay.
I think she's frozen. Yeah. We'll wait.
Okay, so it wasn't just me. All right.
No, I think she's frozen. Come back in. Well, we are down to
physical problems going on in her life right now. Difference.
Leslie, we missed you. Your screen froze, so we didn't hear your question. Can you repeat it for us, please?
Sure. What do you say to people who is one of my clients, almost 75, and she was like, "Well, I only probably have a couple more years, and then I'm done anyway. I don't know why you keep trying to get me into these programs that are going to help me." And then she said, "Well, my mother had died at a certain age. My grandmother died at a certain age. So I probably only have about 4 or 5 years." And I'm looking at her, and I have people in my family who are 75 and they ski, they golf, they do all kinds of stuff. And I'm looking at this younger, she's a little older than me. I'm in my 60s. And so I was like, look, you don't have to, I don't know, about why she decided that, but it did seem like maybe whatever was happening in her family was the reason why she decided on that thought. But I didn't have many encouraging words. I hope I encouraged her, but as I was listening to you, I realized I needed the better script to write. So just because she's not going to be the only client I have to really have those kind of problems. So I need to be able to, not on the top of my head, because I can't remember what I said to her, but it stopped her. I was driving her around. I'm like, come on with this negative thing, but I didn't say that to her. And whatever I said to her, she said, well, that I have to think about that, but I can't tell you what I said because I don't remember. So I think that, like what you said is true, that if we can start writing down some things that might cover those kind of things. So what are your suggestions?
Right. Well, I think one thing is, this is where we're talking about that deep-seated internalized ageism that we all have. And when it starts to rear up, again, we have to call that out. Does she even realize what she's doing is ageist, and that we're not going to be able to change her self-perception just because we tell her she has a negative self-perception.
Right.
However, we do know if you're speaking in well-framed ways, and you call that out for her in a way that's not accusatory, right? Say, I just want to talk to you a little bit about that. That's like some ways of internalized. Do you realize you're internalizing your ageism, and that, the birthday, the years that you've celebrated birthdays does not have to correlate to how you're functioning. And we can help build the structures for you. We have the structures for you so that you can start to think a little bit more about what your next birthday is going to look like. So you have to kind of bring it out. And it's a process. Like, I don't think it's like one visit that you're going to be able to bring that out with her. And she has to hear that consistently so that she can start to believe that that's true. And she has to hear that around her. I'm not sure what else she's hearing around her house. Is she hearing, well, you're an old woman and you're going to die next year anyway, right? If she's hearing that from other people, that makes a difference too. So I think you can help by starting to just make her aware of this. And I think even some of the pieces that we talked about today, you could start to make her think about aging a little bit differently.
Great. Thank you, Trish, so much. Thank you, Leslie, for the question. Such a great presentation, as always, Trish. We always learn so much. I put a couple of sites in the chat for you all. And I think that there will be also a lot of information on the slides that will be shared after the presentation with all those who have registered. So thank you all so much. Thank you for staying for the whole time. We really appreciate all of you and all that you're doing. And we'll hopefully see you all next month. Thank you. Thanks, Trish.
Thanks, everybody.